Hello, everybody. Welcome to the first webinar. My name is Takahiro Nandi. I'm an Executive Director of Sasakawa Health Foundation. We, the Sasakawa Hansen Disease Initiative, which is a strategic alliance between the WHO Goodwill Ambassador for Leprosy Elimination, Sasakawa Health Foundation, and the Nippon Foundations to achieve zero leprosy, have launched a new webinar series to provide a platform to discuss various issues related to leprosy. A total of 9 seminars are planned to be organized between October 2020 and March 2021. So it is the first webinar of the series. And I welcome all of you. So today's theme is Scheme to Support the Organization of the Persons Affected by Hansen Disease during the coronavirus pandemic and their significance. So let me briefly explain about today's program. First, we have a two keynote address from Mr. Yohei Sasakawa, the WHO Goodwill Ambassador for Leprosy Elimination, as well as the chairman of the Nippon Foundation. We also have another keynote address from Dr. Alice Cruz, a United Nations Special Rapporteur on elimination of discrimination against persons affected by leprosy and their family members. So after the two keynote presentations, I myself will make a brief presentation to introduce our new scheme to support the organization of the persons affected by Hansen disease. And after my presentations, we are going to invite 3 representatives of organization of the persons affected by Hansen disease, namely Permata South Sulawesi, Indonesia, Bogra Federation in Bangladesh, and Mahatari Self-Help Group Federation in Nepal. We will then move on to the question and answer sessions. For those who have questions, I'm sure you see the screen now. For those who have questions, please click the question mark. Then you can write and send the questions. And if necessary, you can identify who you want to address your questions. Okay, so now I welcome the keynote address of Mr. Yohei Sasakawa, the WHO Goodwill Ambassador for Leprosy Elimination, as well as the chairman of the Nippon Foundation. He will make his address through video. As many of you know, the Mr. Sasakawa has been WHO Goodwill Ambassador since 2001. Over the years, he has made more than 540 trips, visiting 122 countries to learn underground situation of leprosy. In addition, Mr. Sasakawa actively met the president and the prime minister of many countries to convey the message and importance to work on the leprosy. He's also one of the pioneers who addressed the importance to support the empowerment of the persons affected by Hansen disease. So here is a keynote address of Mr. Sasakawa.
皆さんこんにちは。多くの皆さんは私を知っていらっしゃると思いますが、あるいはご存じない方もいらっしゃるので、自己紹介いたします。私は日本財団の会長の笹川洋平と申します。そして WHO のハンセン病制圧大使も務めております。しかし私は病気を治すだけではなくて、皆様方が長い間苦しんできた偏見に基づく差別の問題を解決しなければ、皆様方の生活環境は変わらないという信念から、単に病気を治すだけではなくて、皆様方の対する社会が持っている病気であります偏見や差別も なくしたいと。いわばオートバイに例えれば、前輪は病気を治すこと、そしてオートバイの後輪は偏見や差別をなくすこと、そしてオートバイが順調に走って初めて皆様方の生活が向上するというふうに考えているわけです。そういう中で、多くの国々でこの辛い病気と人生と戦ってこられた回復者の皆さんが今世界のあちこちで団結をして、そして共に汗をかきながら社会の中で戦いを進め、そして多くの回復者の皆様、そして患者の皆様のために戦おうとして、団結されていることに大変私は感動すると同時に、皆様方の働きに敬意を表しております。今、世界中がコロナの問題で大変な状況にございます。皆様方はそれでなくても大変厳しい環境の中で生活を余儀なくされている中に、さらにコロナという世界的な感染症が今や人々を恐れさせているわけでございます。どんなにか皆様方の生活が苦しくて大変な状況にあるかということは、私は東京にいまして日々大変心配をいたしております。笹川保健財団では、そういう皆様方のご苦労、そして今置かれている苦しい環境について常に胸を痛めて、何か皆様方のためにお手伝いをしたいなということでございます。今回このウェビナーの会議におきまして、皆様方の率直な現状のお話をお伺いし、そして笹川保健財団は皆様方のために何か直接的なご支援をしようと計画をいたしております。長い間困難な人生を歩んでこられた皆様方でございますから、このコロナの問題についても力強く戦い、そして強い皆様方が指導力でもって多くの同僚の回復者の皆さんの先頭に立って戦ってくださるものと確信をしております。どうぞそれぞれのグループの指導者の皆さん、そして、まだこの回復者の組織がない国々もございますが、これからのハンセン病の戦いは、病気をなくすことはもちろんでございますが、病気が治った多くの皆様方の生活が向上するように、そして生活環境がより良くなるように、そして時代を担う子どもたちが十分に教育が受けられるような社会にしていかなければなりません。そのためには、今日お集まりのこの回復者の皆様方の力強い指導力がなくては、私自身の夢も実現をいたしません。どうぞ皆様方と笹川保健財団、そして、兄弟組織である日本財団、私を含めまして皆様と共に力を合わせてより良い社会を作りましょう。そして回復者の皆さん、患者の皆さん、そして、時代を背負う皆様方の 子どもたちのために共に戦ってより良い社会を作っていきましょう。どうぞまだまだ回復者の皆さんの組織のないところについても皆様方にご指導をいただいて力強い組織が世界的にできるようにお互い努力していこうではありませんか。この会議が実りあるものになることを心から期待をいたしております。私は40年間も1年の3割から4割は皆様方の国々や地域を訪問してきました。今年はコロナで全く皆様方のところに行けませんが、一日も早く皆様方のところを訪問し、皆様方と直接お話をし、そして共に明るい将来のために回復者の皆さん、そして患者の皆さん、そして皆様方の子供たちも含めまして生活が向上するようにお互い努力してまいりましょう。どうもありがとう。
For your information, Mr. Sasakawa originally planned to attend this webinar on live, and he was very much excited for interacting with audience. But unfortunately, he is now in Myanmar because he has been appointed by Japanese government as a head of the special delegation to observe Myanmar's general election. So he told me that he would really regret to miss these opportunities. So next, I would like to invite Dr. Alice Cruz, United Nations Special Rapporteur on the elimination of discrimination against persons affected by leprosy and their family members. As many of you know, she has been appointed as Special Rapporteur in 2017, and recently her mandate was extended for 3 more years at UN Human Rights Council. She also co-chaired the Working Group 2 of Global Partnership for Zero Leprosy, emergency advocacy for persons affected, and released the recommendations of specific actions to be taken in responding to the needs and challenges of persons affected during the COVID-19 pandemic. So here's a presentation of Dr. Alice Cruz.
It's a great honor to participate in the first webinar of Sasakawa Health Foundation as the United Nations Special Rapporteur on the elimination of discrimination against persons affected by leprosy, mainly known in Japan as Hansen's disease, and their family members. The COVID-19 pandemic has changed the world. After more than half a year living with its health, economic, social, and political consequences, we are now looking at recovery. As the crisis generated by the COVID-19 pandemic unfolded, the emergence of a humanitarian crisis among persons affected by Hansen's disease and their families became rapidly obvious. After a thorough consultation process that I undertook together with the Global Partnership for Zero Leprosy, I wrote a letter to governments on the disproportionate impact of the COVID-19 among persons affected by Hansen's disease and their families that included 5 key recommendations to them. The global trends of such impact range from access to health to sustenance of livelihoods. Lockdown measures have brought additional barriers in the access to healthcare by persons affected by Hansen's disease, with the loss of financial and human resources from national Hansen's disease programs to the fight against COVID-19, the interruption of key activities for early diagnosis and prevention of physical impairments, and the non-availability of Hansen's disease care in healthcare services. The continuum of care for persons affected by Hansen's disease has been seriously threatened, and for that reason, we can expect a setback in the interruption of transmission and early diagnosis. As the situation evolves in most countries, healthcare services started to resume some of their activities related to Hansen's disease. However, some of the problems have been aggravated, such as the lack of MDT, the treatment for Hansen's disease, in key countries. Access to fundamental goods such as food, energy for cooking, clean water, soap, masks, and other protective items were lacking for a substantive number of persons affected by Hansen's disease and their families during the first 6 months of this crisis. The impossibility of many persons affected by Hansen's disease who have been structurally excluded from the formal labor market to guarantee any income, together with the loss of safety nets essential for their survival in the context of the quarantine and other exceptional measures enacted by states, has determined that many persons affected by Hansen's disease and their families have been left to live in extreme poverty. In order to respond to this humanitarian crisis, I called upon states to implement social security schemes that would allow individuals and families to acquire minimum health care, basic shelter and housing, clean water and food. Many organizations of persons affected by Hansen's disease have been advocating for social protection measures in their countries as well. In the cases where states have implemented cash transfer programs to ensure minimum standard of living for vulnerable populations during the crisis, such benefits have been in great measure inaccessible to persons affected by Hansen's disease for different reasons. So far, out of all the countries that I was able to monitor, only Myanmar reported action taken by the government to specifically meet the needs of persons affected by Hansen's disease. In most countries, temporary food aid was the most common measure, but many of these measures have expired after the initial outbreak response, although the needs of the people persist. In the case of the more vulnerable groups within the overall population affected by Hansen's disease, older people living in former Hansen's disease sanatoriums were from the start at a higher risk. There are still up to 2,000 of such places in the world today, and there is a great number of issues of concern, such as generalized institutional neglect leading to lack of food, clean water, and hygiene and protective items, but also lack of biosecurity plans that can prevent the spreading of COVID-19 within these places. There is also the fact that some countries have turned parts of these sanatoriums into field hospitals for COVID-19 patients, putting the elderly population at a greater risk. An even more disproportionate impact of the current crisis within the population affected by Hansen's disease is found among women, refugees, persons with disabilities, people living in remote areas, among which children are of the greatest concern. In my letter to the governments, I present 5 key principles that should guide responses to the consequences of the crisis in the medium and long term. Here, I would like to highlight the 4th principle. As I tell governments, in the face of their limited action to ensure that information about COVID-19 is accessible to those left furthest behind, in order to achieve public health education goals that are central to containing the novel coronavirus, the participation of grassroots organizations is critical for ensuring that relevant information reaches all people. Such key participation should be supported with proper funding. Such organizations play a key role in mainstreaming good practices, fulfilling institutional gaps, and providing support services. Meaningful participation of the organizations of persons affected by Hansen's disease in policy making, monitoring, and evaluation is essential to ensure an inclusive responses to the crisis. By the same token, building autonomy through empowerment is vital for marginalized persons to achieve greater control over their lives and further their democratic engagement in public affairs. The agenda for the Sustainable Development Goals is built upon the recognition that development is not only about transforming the material conditions of people in disadvantaged circumstances, but that also implies providing them with a voice and choice. This was also the spirit of the recommendations to NGOs presented in the report that I have issued together with the Global Partnership for Zero Leprosy. There, I recommend NGOs to develop and put in place a participatory framework for humanitarian aid that links relief to development, to support grassroots organizations with funding and capacity building, and work with them to share information about COVID-19 and existing national social protection schemes to persons in the community. As we begin rebuilding our societies in the context of the crisis generated by COVID-19, we need to make sure that sustainability leads each and every one of our actions. Only through the empowerment of persons affected by Hansen's disease will systemic change be made possible. That is why I congratulate Sasakawa Health Foundation for creating a grant program aimed at redressing the impact of the COVID-19 crisis, which is built upon the principles of ownership and promotion of autonomy. Sasakawa Health Foundation's grant program aims at recognizing and respecting local knowledge and expertise, while at the same time strengthening capacity of organizations of persons affected by Hansen's disease. By simultaneously linking relief to development and by respecting their autonomy in implementation, this grant program responds to the need to enable the leading role of persons affected by Hansen's disease as protagonists of change. I wish Sasakawa Health Foundation and the organizations involved in this new program a great success in the defense of the rights of persons affected by Hansen's disease and their families. Thank you.
So we really appreciate her warmest message to the foundation. Actually, we also wanted Alice to be on live. But unfortunately, due to the time difference, we have recognized that it is not physically possible because she lives in Ecuador and it is 2:30 in the morning for her. So next is my turn. I'm briefly make a presentation about schemes to support organization of the persons affected by Hansen disease we recently launched. So I want to start from background. So Sasakawa Leprosy or Hansen disease initiatives, as I said, a strategic alliance between the WHO Goodwill Ambassador for Leprosy Elimination and Sasakawa Health Foundation and the Nippon Foundation has been quite active to engage into the empowerment of the organization of the persons affected by Hansen disease. For instance, as of now, both the Sasakawa Health Foundation and the Nippon Foundation has supported more than 20 organizations from 18 countries. And also, maybe some of you may remember, last September in Manila, we organized the Global Forum on the People's Organization of the Persons Affected by Hansen disease. More than 80 representatives of the persons affected attended the Global Forum. We also pay attention to the work of the Working Group of Global Partnership for Zero Leprosy, Emergency Advocacy for the Persons Affected, has released recommendations of specific actions to be taken in order to respond to the needs and challenges of the persons affected during the COVID-19 pandemic. So our thought was that organizations of the persons affected by Hansen disease are not merely recipient of aid, but gain a sense of ownership by being involved in community support, directly contributing to problem solving. So in other words, we believe that the persons affected should play central role to solve their own problems other than just being a recipient. We also saw that strengthening the organizational capacity is a key, taking into account the sustainability of the activities. Encouraging the collaboration between organizations of the persons affected and their partner organization is also crucial to enrich the quality of some activities, such as conducting strategic advocacy or information dissemination in English. So based on those thoughts, we have decided to launch the 3 pilot projects, namely in Bangladesh, Indonesia, and Nepal, from May to August this year. So you'll hear the outcomes and some lessons learned from those projects from the representative of the persons affected by Hansen disease later. So based on the result of the pilot project, we come up with an idea for a new grant program to support the organization of the persons affected. There are four pillars in our scheme. The first pillar is responding to the direct needs of the communities. Activities include such as providing relief supplies, small loan for livelihood development, materials for children to enroll in school, materials to maintain self-care practices, information disseminations on prevention of the COVID-19, establish hotlines, offering counseling. Especially during the COVID-19, this pillar must be very important to promptly respond to the needs of the communities. The second pillar is advocacy with government. The activities include such as requesting local governments to guarantee access to existing support schemes, consider new support schemes, and so on. As a realities, our foundations are not able to support all the people who need support. So some of the work should be done by the government. So in that context, conducting advocacy to government or local authority must be very important. And third pillar is information dissemination, such as through SNS, for the purpose of widely sharing the project activities, raising the profile of the organization, acquiring the new supporters, and strengthening the PR capabilities. I think information dissemination could be an important means for each organization to expand external supporters and constituency, because, for instance, our foundation can support each organization forever. Fourth pillar is capacity building training lectures. to take courses to learn about the fundraising, crowdfunding, social business to increase the sustainability of the organization. Actually, the fourth pillar didn't include in the pilot project, but we have decided to add this pillar in the new scheme because just based on our experiences to organize global forum on the People's Organization Hansen disease in last year in Manila, we figured out that many of the organizations of the persons affected, the financial sustainability is the most important issues. So we are happy to provide the opportunities for the organizations to take training courses to have some basic knowledge to enhance the financial sustainability of the organization. So this is the detail of our grant scheme. Who to apply? We encourage the organization of the persons affected by Hansen disease, of course, in countries or regions where the leprosy is endemic and that have been seriously impacted by COVID-19. And we called the application from September 24th to October 4th. It was very much short period, but we wanted to make decisions quickly in order to promptly respond to the needs of the communities. In this new scheme, we have two programs, Program A and Program B. The Program A, we expect the grantees to engage into all the periods from 1 to 4. And the budget of the project is up to $50,000, and the project period will be 1 year. The Program B, we encouraged mainly the Pillar 1 and Pillar 4 for the grantees, but not limited to those of them. And the budget will be up to $10,000, and the project period is 4 months. And for your information, we have received a proposal from 32 organizations. And as a result of the internal review, we have decided to support 22 organizations from 14 countries. Total amount of our support is approximately $340,000 US. So this is the list of the organization we are going to support. The organizations who were supported under Program A are colored in the different, the yellow colors. So in this slide, the Bogra Foundation from Bangladesh and Permata Sastra in Indonesia. So this is a list of the organization of the persons affected, together with the partner organization. So we have 2 organizations from Bangladesh, 3 from Brazil, 1 from Ethiopia, 2 from India, 3 from Indonesia, 1 from Kenya, and Mozambique, and 2 from Nepal, Niger, 2 from Nigeria, Philippines, Senegal, Sierra Leone, and Tanzania. And for your information, we are planning to call for the application for the second round, probably around March 2021. Also, the budget is relatively smaller than the first round. So those organizations who didn't apply for the first round, or unfortunately who are not accepted in the first round, are encouraged to apply for the second round. So finally, I want to end my presentation by this statement. We understand that our support is not enough and too small to respond to real needs. Unfortunately, we are not able to support all the people because our resources are limited. However, I believe that what we can do is use those resources to the best use of our ability. Therefore, we welcome your suggestions and advice on how we can be more effective in responding to the real needs of the persons affected on the ground. Thank you very much. So now I want to move on to the main part of this webinar. We have a presentation from 3 organizations of the persons affected, as I said, Permata South Sulawesi, Indonesia, Bogra Federation in Bangladesh, and Mahatari Self-Help Group Federation in Nepal implemented pilot project from May to August this year. So we invite them to share the experiences and lessons learned from the pilot project. So first is Indonesia. I want to invite Ms. Yuliati. She is a chairwoman of Permata South Sulawesi. Permata Indonesia was established in 2007. And Permata South Sulawesi, which is one of the 3 provincial level branches, holds 12 branches within the province. The main activities include advocacy, public awareness, new case finding in the communities, and networking with other organizations. Through the pilot project, the activities were jointly implemented with YDTI. So Ms. Yuliati, the floor is yours.
Ya, Assalamualaikum warahmatullahi wabarakatuh dan selamat sore. Saya Yuliati, saya akan mempresentasikan proyek percontohan yang telah dilakukan di Indonesia, khususnya di Sulawesi Selatan.
So, greetings for all. Good afternoon. So, I am Yuliati. I will be presented our result about the emergency support we have get from the Sasakawa Health Foundation for the South Sulawesi Province in Indonesia.
Tujuan dari proyek ini secara keseluruhan adalah membantu orang yang sedang dan pernah mengalami kusta yang ada di Sulawesi Selatan agar dapat bertahan dari pandemi COVID-19, baik dari segi penyakit maupun dari segi sosial ekonomi.
So the aim of this project is to support people affected by leprosy in South Sulawesi, so they can be continuing their to survive their life for their daily life.
Selanjutnya.
Next, please.
Ya. Permata Indonesia merupakan satu-satunya organisasi dari dan untuk orang yang sedang dan pernah mengalami kusta di Indonesia.
So, Permata is the one of the organization from and only for the person affected by leprosy in Indonesia.
Ya, Permata Indonesia wilayah Sulawesi Selatan mendapat dukungan penuh dari Sasakawa Health Foundation untuk tanggap darurat dalam membantu orang yang sedang dan pernah mengalami kusta di masa pandemi COVID-19.
Permata in South Sulawesi Province has received support from the Sasakawa Health Foundation for the emergency responses during the COVID-19 pandemic in South Sulawesi.
Dukungan ini selama kurang lebih 3 bulan yang dimulai sejak tanggal 15 Mei sampai 15 Agustus tahun 2020 di 5 kabupaten kota yaitu Kota Makassar, Goa, Jeneponto, Bulukumba, dan Toraja Utara.
This project was running for 3 months from the 15 May until 15 August 2020 in 5 districts, namely Makassar, Goa, Jeneponto, Bulukumba, and North Toraja.
Selanjutnya.
Next, please.
Ya. Sebagai persiapan awal yang dilakukan oleh teman-teman Permata yang ada di 5 kabupaten, yaitu melakukan koordinasi dengan tim gugus COVID-19 di tingkat kabupaten.
So for the beginning, Permata in 5 districts have a coordination meeting with the district COVID-19 task force from the government.
Tujuan dari koordinasi ini ada beberapa, yaitu yang pertama melakukan sosialisasi terkait proyek yang akan dilakukan di lapangan. Tujuan yang kedua meminta arahan terkait protokol kesehatan yang harus dipatuhi oleh teman-teman saat di lapangan. Dan tujuan yang terakhir adalah meminta dukungan dari tim gugus, baik itu berupa surat rekomendasi ataupun ID card yang dapat membantu teman-teman saat di lapangan.
So the purpose from this coordination meeting is to introduce this project related with what the Permata will doing in the field with the people affected by leprosy, and secondly to asking the health protocol related with the COVID-19, so they can be go to the field with running the protocol. And the third is to asking the support also to recommendation from the government, such as to give the ID card and also the recommendation letter, so the people from the Permata can go to the field with the also recommendation from the government.
Selanjutnya.
Next, please.
Ya, persiapan lainnya yang dilakukan oleh teman-teman Permata yaitu melakukan kunjungan ke puskesmas untuk mengumpulkan data orang yang sedang dan pernah mengalami kusta.
So the second to preparation, people from the Permata collecting the data from the health centers. So when they go to the field, they can using the data from the health center.
Ya. Data tersebut menjadi acuan untuk dikunjungi oleh teman-teman untuk melaksanakan proyek ini.
So this data will be as a guidance from the Permata people to go to the field.
Selanjutnya.
Next, please.
Ya, adapun beberapa kegiatan dari proyek ini, yaitu yang pertama pengenalan terkait corona ataupun bagaimana cara pencegahannya, di mana telah dilakukan di Kabupaten Goa sebanyak 185 orang, di Jeneponto sebanyak 238 orang, di Bulukumba sebanyak 208 orang, di Toraja Utara sebanyak 60 orang, dan di Makassar sebanyak 222 orang.
So this is the activity we conducted in the field to give the information about the COVID-19. This is the right information about the COVID-19. So we reach in Goa district 185 people, in Jeneponto district 238 people, in Bulukumba 208 people, in North Toraja 60 people, and in Makassar 222 people.
Ya, sosialisasi ini juga sekaligus dibagikan poster yang akan dipasang di rumah orang yang sedang dan pernah mengalami kusta, sehingga tetangganya dapat juga membaca terkait informasi corona.
So during the education information about the COVID-19, from the Permata also spreading, giving the people the leaflet about the COVID-19.
Selanjutnya.
Next, please.
Ya, kegiatan yang kedua yang dilakukan adalah membagikan alat pelindung diri seperti sabun dan masker untuk orang yang sedang dan pernah mengalami kusta.
So for the next, this is we distribute the protect equipment such as the soap and also the mask for the people.
Ya. Adapun jumlah total yang telah dibagikan yaitu sebanyak 1.826 masker dan sabun kepada 913 orang.
So the total number of the distribution of the protect equipment is 1,800 more. This is give to the 913 people.
Ya. Seperti di Goa telah dibagikan sebanyak 370, di Jeneponto sebanyak 476, di Bulukumba sebanyak 416, di Makassar sebanyak 440 orang, dan di Toraja Utara sebanyak 120.
So like in Goa, we give to the 370 people, in Jeneponto to the 476 people, in Bulukumba 418 people, in Makassar 444 people, and in North Toraja 120 people.
Selanjutnya,
next please.
Ya, selain kegiatan tersebut, teman-teman juga di lapangan melakukan pembagian sembako atau bahan makanan kepada orang yang sedang dan pernah mengalami kusta yang dikunjungi yang masuk dalam kategori kurang mampu.
During the visitation to the in the field to the people affected by leprosy, we are also distributing food package to the people affected by leprosy.
Adapun jumlah paket sembako yang telah dibagikan yaitu sebanyak 1.533 paket kepada 511 orang yang ada di 5 kabupaten kota.
So the total number of the packets are 1,533 packets to the 511 people.
Ya, yaitu di Goa sebanyak 300 paket, di Jeneponto sebanyak 300 paket, di Toraja Utara sebanyak 159 paket, di Bulukumba sebanyak 216 paket, dan di Makassar sebanyak 561 paket.
Namely in Goa 300 packets, in Jeneponto 300 packets, in North Toraja 159 packets, in Bulukumba 215 packets, and in Makassar 561 packets.
Ya, sembako ini atau bahan makanan ini dibagikan setiap bulan, satu paket kepada satu orang. Jadi satu orang mendapatkan 3 kali sembako.
So this food package was giving to the people in every month. So that is for 3 months. So one people can get 1 package in every month.
Selanjutnya.
Next please.
Ya, kegiatan lainnya yang dilakukan yaitu melakukan advokasi ke pemerintah lokal.
So another activity we are conducted is to give advocacy to the local government.
Ya. Advokasi yang dilakukan baik terkait bantuan makanan kepada OYPMK atau orang yang sedang dan pernah mengalami kusta yang tidak mendapat bantuan dari pemerintah.
So the advocacy also to advocate the food aid to the government. Some of the government have a food package also to give to the people in the field.
Selain itu, teman-teman Permata juga melakukan advokasi ke sekolah karena pada saat kunjungan telah ditemukan anak yang sedang mengalami kusta yang harus putus sekolah karena mengalami kusta.
So during our visitation to the field, we get some problem. One is one of the children affected by leprosy who has just rejected from the school. So we go to the schools to advocate about these problems to that school.
Teman-teman juga melakukan advokasi ke dinas sosial terkait jaminan kesehatan yang untuk orang yang sedang dan pernah mengalami kusta, karena di lapangan terdapat beberapa orang yang tidak mempunyai jaminan kesehatan ataupun kartu identitas seperti KTP, sehingga mereka kesulitan untuk mengakses bantuan dari pemerintah.
So we also go to the social welfare department in local because some of the people in the field, they doesn't have the health insurance. The health insurance was published from the social welfare department, and also they doesn't have the identity card. So we advocate this problem also to the social welfare department.
Teman-teman juga melakukan advokasi ke kelompok PKK karena masih adanya stigma dan diskriminasi yang terjadi di masyarakat.
And also we go to the women's organization from the government because we get the stigma and discrimination against people affected by leprosy, and also the COVID-19 will still happen in the field.
Selanjutnya.
Next, please.
Ya. Kegiatan lainnya yang dilakukan yaitu melakukan pendampingan kepada orang yang sedang dan pernah mengalami kusta yang mempunyai gejala COVID-19. Namun saat di lapangan atau selama proyek berlangsung, teman-teman tidak menemukan kasus.
So the next activity is we assistant for the person with affected by leprosy who have COVID-19 symptoms. But during the project, we doesn't get the person affected by leprosy who have COVID-19 symptoms.
Ya. Kegiatan lainnya juga yang dilakukan yaitu pendampingan kepada orang yang sedang dan pernah mengalami kusta yang mempunyai gangguan psikologis akibat pandemi COVID-19.
So we also assistance for the person with symptoms of the stress due to the COVID-19 pandemic.
Ya. Kegiatan ini hanya dilakukan oleh teman-teman Permata yang ada di Makassar, yaitu mendampingi 2 kasus di mana orang yang pernah mengalami kusta mengalami kehilangan pekerjaan ataupun mengalami penurunan penghasilan. Namun bukan hanya itu, di kabupaten lainnya juga terdapat masalah yang sama, namun mereka tidak mengalami stres yang mengganggu atau tidak terlalu bermasalah bagi mereka, sehingga tidak dicatat oleh teman-teman di lapangan.
So this activity to assistance the person who have stress symptoms, we conducted in Makassar. That is because of some of the people who losing the job because of the COVID-19, and also some of them just decrease the income because of the COVID-19. This problem also we get in another districts, but from them because of the districts, maybe they have a family or something else in the district, so they're not they think this is not a big problems for a while.
Ya. Selain 6 kegiatan utama yang dilakukan, teman-teman juga melakukan bantuan kepada orang yang sedang dan pernah mengalami kusta sesuai dengan kebutuhan mereka. Seperti contohnya yang ada di gambar, teman-teman Permata melakukan pendampingan kepada Pak Pampang yang mempunyai luka yang cukup parah pada kakinya sehingga harus didampingi untuk dirawat di rumah sakit. Dan hasilnya Pak Pampang dirawat di rumah sakit Tajuddin dan beliau sudah dioperasi.
So from the 6 core activity, we also assistance for the people affected by leprosy who have needs about the leprosy problems like reaction and etc. So this, if you see in the screen, one of the people just assistant from the people from the Permata to go to the leprosy hospital because they have a reaction, and also when they bring to the leprosy hospital, he get a surgery.
Selain itu, teman-teman juga melakukan pendampingan kepada orang yang putus berobat ataupun melakukan pendampingan kepada suspek yang ditemukan di lapangan sehingga mereka dapat berobat.
So also we just helping the people who have just stopped from the drug MDT. So we give the support them to have MDT again.
Selanjutnya.
Next, please.
Adapun beberapa tantangan yang dialami oleh teman-teman selama di lapangan, yaitu seperti data yang ditemukan di puskesmas banyak yang tidak lengkap sehingga sulit untuk diakses oleh teman-teman.
So we also facing the challenges from the field, such as one of the big challenges is the data obtained from the community health centers are incomplete or are lost.
Ada juga data yang disembunyikan oleh petugas karena pasien tersebut tidak mau identitasnya diketahui oleh orang lain.
Some of data also is hiding from the health staff because of these people is they don't wanna what is the data is just go outside from the health center.
Masih tingginya stigma yang terjadi di masyarakat.
There is a still high stigma in society.
Stigma dan diskriminasi sering menghantui orang yang sedang dan pernah mengalami kusta sehingga mereka cenderung menyembunyikan diri.
So stigma and discrimination haunt people affected by leprosy. So sometimes they are more likely to hide themselves.
Orang yang dikunjungi kadang tidak ada di rumahnya, ada juga yang pindah tempat tinggal ataupun ada yang pergi merantau.
Some of people we visiting their house, but they're now in the home.
Ya, selain itu, kadang juga orang yang dikunjungi tidak mau mengaku pernah mengalami kusta karena takut ketahuan oleh tetangganya.
So some of the people in the field is they don't wanna then say I'm not a people affected by leprosy because they scare if the neighbor know or recognize he's a people affected by leprosy.
Selain dari itu, teman-teman juga kesulitan untuk mengakses orang yang sedang dan pernah mengalami kusta yang tinggal di pelosok. Karena teman-teman harus melewati hutan dengan berjalan kaki, mendaki gunung, harus melewati sungai, dan lain-lain.
So the big challenges also is the access to go to the field is very difficult. They need to passing the forest, go the river, passing the river. and sometimes the road is not properly good to go to the field.
Selanjutnya.
So next, please.
Ya, itulah tadi yang bisa saya sharingkan terkait proyek percontohan yang telah dilakukan di Indonesia, khususnya di Sulawesi Selatan. Terima kasih atas perhatiannya.
So that's
Salam.
all I can share to all of you about the result of our pilot project. So thank you very much for your attention.
Thank you, Ms. Yuliati. Very nice presentation. I really admire the work done by the members of Permata South Sulawesi and also your leadership. As you presented today, you and your colleagues continuously and tirelessly visited each household of the persons affected by Hansen disease to listen to them. So I think, you are the right persons for us to learn about the underground situation of stigma and discrimination associated with leprosy or Hansen disease. So thank you very much. So next, I want to invite Mr. Sharif. He is the chairman of Bogra Federation in Bangladesh. Bogra Federation is an organization of persons affected by leprosy at Bogra district. The federation consists of more than 1,000 members. The main activities include advocacy, awareness raising, networking with other organizations. Through the pilot project, the activities were jointly implemented with Lepra Bangladesh. So floor is yours, Mr. Sharif.
আসসালামু আলাইকুম। আমি বগুড়া ফেডারেশনের চেয়ারম্যান এবিএম শহীদ শরীফ। আপনারা কেমন আছেন?
Yes, so I am Shohid Sharif, the chairman of Bogra Federation. How are you all?
আমরা বাংলাদেশের কুষ্ঠ আক্রান্ত ব্যক্তিদের COVID-19 একটি জরুরি সহায়তায় পাইলট প্রকল্প প্রস্তাবনা, তার জন্য আমাদের ধন্যবাদ প্রস্তাব করেছি।
I want to give special thanks because of this special project on COVID-19. This is an emergency assistance for this person affected by leprosy in Bangladesh. Next slide, please.
বগুড়া ফেডারেশনের সরকারি অনুমোদিত 12টি উপজেলা ফেডারেশন 1030 জন সদস্য সিরাজগঞ্জ ও পাবনা নাটোর জেলায় আমাদের নেতৃত্ব এবং সহযোগিতা প্রদান করতেছে। সিরাজগঞ্জ ফেডারেশনের 10টি উপজেলা ফেডারেশন 111টি দল 1395 সদস্য, পাবনা ফেডারেশন 10টি ফেডারেশন উপজেলা ফেডারেশন 111টি দল 1433 জন সদস্য, নাটোর ফেডারেশনে 6টি উপজেলা ফেডারেশন 8টি দল 1028টি জন সদস্য।
So the Bogra Federation, which actually this you can see that's government approved. There is 12 sub-districts and there is 12 sub-district federation, 101 self-help groups, 1,030 members, and this Bogra Federation now taking the leadership role and giving the technical support to other 3 district federation that's established in Sirajganj, Pabna, and Natur. If you could see that in the Sirajganj Federation, there is 10 sub-district and there is 10 sub-district federation, and then 111 self-help groups and 1,395 members. In Pabna, 10 sub-district federation, 100 the same number of self-help groups also in these districts, 111, and there is 1,433 members. And in the Natur Federation, there is 6 sub-district federation, 78 self-help groups, and 1,028 members. Next slide, please.
সমর্থন এলাকা জেলার সময়ে বগুড়া জেলা ফেডারেশনের ফেডারেশন অন্য 3টি ফেডারেশনের নেতৃত্ব সহায়তা করে আসছে। ম্যাপে আমাদের দেখা যাচ্ছে বগুড়া, তার পার্শ্ববর্তী আমাদের এই নাটোর, সিরাজগঞ্জ, পাবনা এই ধরনের আমরা সহায়তা করতেছি।
So Bogra Federation is taking the leadership role and supporting the other these projects implemented. So there is total in the 4 districts by 4 district federation. Next slide please.
এমপি প্রকল্প ফলাফল জেলায় ফেডারেশনের সদস্যদের সাথে মিটিং পরিকল্পনা করা, 36 জন সিসি, 760 জন সুবিধাভোগী খাদ্য সহায়তা করা, 400 জনকে আর্থিক সহযোগিতা, 500 জনকে কোভিড-19 এবং উপলক্ষে বিতরণ করা, 15,000 সম্প্রদায়ের মানুষকে কোভিড-19 সচেতনতা বৃদ্ধি করা।
So under this project, we have taken this special initiative. Initially, we have the planning meeting with district federation members, and through this project, the 36 community champion, the volunteers, they supported the total project period, and then we have given 730 beneficiaries food support, 400 financial support, and also 5,000 materials on COVID-19 they distributed, and also 15,000 community people they been award on, especially on the COVID-19. And you could see the picture here, yeah, advocacy meeting and also next slide please.
আক্রান্ত ব্যক্তিদের প্রতি আমাদের অঙ্গীকার, এখানে আমরা ছবি দেখতে পাচ্ছেন, সেগুলো কাজ আমরা সংগঠন করি বা ফেডারেশন করি।
So our commitment towards the people affected by leprosy, you could see there the pictures where these especially food package distributed, and also in the both picture you could see the distributed package between the person affected by leprosy. Next slide please.
কর্মসূচির প্রভাব পরিবারের সদস্যদের কোভিড-19 থেকে সুরক্ষিত ছিল, এবং 36 জন সিবি এবং দীর্ঘদেহী সহায়তা, ঈদের পূর্বে সহায়তার জন্য সুবিধাভোগীদের খুশি হয়েছিল, দলের প্রতি কৃতজ্ঞতা তারা সুরক্ষিত বা অনুভব করেছিল। অ্যাডভোকেসি এবং মাধ্যমে সরকারি কর্মচারীদের সাথে সহযোগিতা বৃদ্ধি করেছি, যেমন পাবনা জেলা ফেডারেশনের নিবন্ধনে প্রায় সম্পূর্ণ দুটি আলাদা মডেল অর্জন করা হয়েছে, খাদ্য সহায়তা এবং আর্থিক সহায়তা।
So when we look the program impact, so through this special project, family members we have seen that they're protected from COVID-19, and also 36 community volunteers they have been selected from these groups, self-help groups, so they are still working on their community with the people affected by leprosy. And especially people, the beneficiaries are so much happy because that time the COVID-19, the lockdown, so many problems and financial constraint. That time the Eid, the Muslim festival, they received this special support from the Sasakawa Health Foundation. So we are very much thankful to Sasakawa Health Foundation. Beneficiaries, they after receiving those support, they feel secured. Government official also extended their support, advocacy meeting. So you know that the Bogra Federation is registered under government registration, so government approval. So another 3 districts, the Nator, after this advocacy, the Pabna, especially Pabna, the government is supporting to get the registration, so soon they will get the government approval. And we have observed the two different model implemented, direct food support and versus financial support, and we learn through this implementing through different model in our area.
এদের পক্ষে বাধা সমূহ কোভিড-19 জন্য আমরা সম্পর্কে প্রকল্পটি এবং বাস্তবায়ন করতে পারিনি, এবং লকডাউন বা সামাজিক করার জন্য সামাজিক দূরত্ব এবং সরকারি কর্মচারীদের সাথে আমরা অ্যাডভাইস করতে পারি, এবং সুবিধা ভিত্তিতে এবং যাচাই করতে গিয়ে অনেকে বাধা বিঘ্ন হয়েছে, যে সেখানে রাজনৈতিক সাম্প্রদায়িক স্টাফ এবং বন্যা এবং দ্রুত এলাকায় আমরা চলাচল করতে পারি।
So what challenges we observe during this project implementation, that's especially during this COVID-19 situation, the lockdown, social distance, maintaining social distance, that actually given us some problem or some experience these challenges during especially this time to implement project. And also the government participant, because of this COVID-19 situation, also we found sometime they mentioned that this is because as a whole the government ensured that everybody should maintain the social distance, and so that kind of some effects we have observed, and sometimes we didn't get the participant up to the mark. And also while selecting, because these group members, they selected who will get this benefit, and then they also realized some pressure from the local community leader, from the local community. Okay, please include that person, please include my relative. That kind of situation also they observe. And at the same time, 3 different flood actually affected area, especially Bogra and Sirajganj. We observe movement was restricted for the flood affected, especially in the flood affected area. Next slide, please.
আমরা কিভাবে সামনের দিকে আগাবো? সুবিধাবাদীদের সামাজিক সুরক্ষা কর্মসূচিতে আত্মগত করা এবং জেলা পর্যায়ে আগে অ্যাডভাইস করে নেওয়া, এবং এখন উপজেলা বা ইউনিট এখানে অ্যাডভাইস করে করায় এবং স্থানীয় সরকারের কাছে কাজে লাগানো।
So through this project, we also learn in the future, we want to include beneficiaries under the government social safety net program. So we already, in this project, we had the advocacy program at district level, but in future, we have planned to go beyond the district at sub-district and union, or and under the sub-district level, where the local government directly given support for different type of safety net under the safety net program. Next slide, please.
এইগুলি আমরা করতে পারলে আমরা বয়স্ক ভাতা, বিধবা ভাতা এবং প্রতিবন্ধী ভাতা এবং ঘর, আশ্রয়, হুইল চেয়ার, সেল মেশিন, শিক্ষা, চিকিৎসা, স্বাস্থ্যসেবা এবং আরো আইনি সহযোগিতা পেতে পারবো।
So you are looking there is a list of different like old age allowance, and he already mentioned about wheelchair, house, and different type of financial support. So these supports are now available in the community, especially what I mentioned about the sub-district and union level. So the next plan is to, through the advocacy program, involve those community leaders, politicians, and the government officials, so that our beneficiaries could get these allowance in future. Next slide, please.
ধন্যবাদ সুবিধাবাদীদের এবং তাদের এবং উপর বিশেষ বিশেষ কৃতজ্ঞতা স্বীকার করি। যেমন করি আমি সভাপতি হিসাবে ABM শরীফ সাসাকাওয়ার নিকট সাসাকাওয়া নিপন ফাউন্ডেশনের চেয়ারম্যান ও তার পরিবার এবং দলকে আমার আন্তরিক ধন্যবাদ এবং আরো কৃতজ্ঞতা জানাই তার দ্বারা আমার আমার এই অন্ধকার থেকে আমরা আজ আলোর পথে গেছি। আমরা দৃঢ় তাদের বিশ্বাস তারা যেন আমাদের সঙ্গে আরো থাকে বা আরো যেন আমাদের হাতকে যেন শক্তিশালী করার জন্য আমি তাকে অনুরোধ করিতেছি এবং আরো বলি যে তারা আমরা যেভাবে আমরা কাজ করতেছি তার সহযোগিতা অনেক কিছু যেন আমরা পাই বা এই আশা ব্যক্ত করে আমার বক্তব্য শেষ করছি।
So I am the chairman of Bogra Federation ABM Sharif. I am giving special thanks to the Sasakawa Health team and the Nippon Foundation chairman, especially for offering this special project for us.
So thank you very much, Mr. Sharif. Very impressive presentation. I also admire your leadership. I really impressed your idea to nominate the community champion and corona fighters. I think, this can be a good model case for other countries that the persons affected by Hansen disease should play a central role to solve their own problems. So thank you very much. And now I want to apologize one thing to the audience. We are expecting to have one more presentation from Nepal, but because of the bad connections, our friends from Nepal are not able to access to internet now. So we'll try to fix this. Maybe we can record the presentation from Nepal in some ways, and we can try to share the video with you in internet. So now we want to move on to the question and answers. So all the speaker can turn on the camera, please. So we are supposed to finish this webinar in 90 minutes. So we only have about 8 minutes. So maybe we can ask you a question, maybe 1 or 2 questions. I hope it will be okay with you. So first question is to all of you. So maybe each of you can answer to this question. The question is, how did you encourage the leaders to keep the motivation during the difficult situations, motivation to continuously in working? So maybe I can invite Bangladesh at first. Mr. Sharif?
Yes.
Maybe you can translate that first, Dr. David.
Yeah, Sharif Saheb. আচ্ছা, প্রফেসর টাকা হেরন আনরে উনি বলছেন যে কিভাবে আমরা ওদেরকে উৎসাহ তাদের কাছ থেকে পেতে পারি। আপনারা যারা লিডার আছেন, তাই না, যে আপনারা কাজ করে যাবেন, ওনারা বলছেন কিভাবে এই উৎসাহটা আপনাদেরকে দিতে পারে, কি করলে আপনারা উৎসাহ এটা পাবেন যেন সামনের দিকে আরো কাজ করতে পারেন, আপনাদের নেতৃত্ব যেন আরো বাড়ে।
আমরা সবার সাথে মিটিং করব, মিটিং করে আমরা তাদেরকে প্রচার করে আমরা এই করব, মিটিং করিয়ে দেব, তারপরে নেপ্রাস সহযোগিতা আমাদের এই করবে, সহযোগিতা করবে এবং আমাদের প্রতিটি কাজে তাদের বিয়ে থাকবে। আমাদের আমরা প্রতি 3টে ডিস্ট্রিক্ট আমাদের আছে, তাদের লিডার সাথে আমরা মিটিং করব বা তাদের নিয়ে আমরা এই সব কাজ আমরা করব।
Okay. So what Mr. ABM Sharif is saying that if they get support, especially for because the 3 district federation are just coming up. Okay, so he wants to arrange meeting with them and try to give this information. The support is available and in future there is a possibility to work together. So he is saying that to keep relationship with those 3 district federation, and also together with the lepra, they will be more motivated to continue their work.
Thank you very much, Mr. Shaif. It seems that solidarity among the members of self-help groups are very crucial. So now I want to invite Ms. Yuriati to answer to the question. Mr. Dodi, maybe you can translate for Ms. Yuri.
Yes, thank you. Oke, Yuli. Pertanyaannya itu adalah bagaimana Anda bisa mendorong para pemimpin untuk bisa memiliki motivasi yang luar biasa di dalam menjalankan proyek ini.
Ya, terima kasih. Pertama-tama kami mencari teman-teman yang memang mempunyai komitmen dari awal di Permata, kemudian kita memperkenalkan tujuan dari proyek ini dan meminta apakah mereka bersedia terlibat dalam proyek ini atau tidak. Seperti itu.
Lanjutnya, itu saja.
Ya.
Okay, so based on Yuli said, they are just looking for the from the Permata officers who have a strongly commitment to conduct the project for the field, and also after that they just give the information about this project to all of them, so they can doing the activity, the project in the field, in the field with the good what is performance, because the guidance from the project is very important to tell to the people. So that's all.
Selain itu saya tambahkan juga teman-teman merasa bersyukur karena proyek ini memberikan penggantian transport buat mereka sehingga mereka juga dapat membantu keluarganya. Selain itu teman-teman sangat senang melakukan kunjungan karena dapat bertemu kepada saudara-saudara mereka, yaitu sama-sama orang yang sedang dan pernah mengalami kusta, dan merasa tambah bersemangat ketika orang yang dikunjungi berterima kasih kepada mereka atas apa yang mereka telah lakukan.
Okay, and also from the officers, from all the leaders of Permata in the districts is very thankful also to SHF because also from this project they can get the reimbursement of the transportation. So that's mean they also can be support for the economic base like that. And for the secondly is they is very thankful also because they can go to the field in this during the project. They can meet with another people affected by leprosy. Some of them they already meet before, but most of them they just that is the first time they meet with the people affected by leprosy in the field, so they can see the condition, they can see, they can talk each other, and they can give the motivation also to another person affected by leprosy, and that is bring more a new motivation also for this all the leaders when they go to the field and show the people affected by leprosy in the field and show their condition also.
Thank you.
So thank you very much, Ms. Yuriati. Thank you very much for your warmest word to the foundation. But I just want to tell you one thing: whatever financial support we are able to provide to you, without a strong commitment of your members, nothing can be done. So I really admire the strong commitment of the members of Permata to implement this project. So I think time is almost getting up, but if I'm permitted, I want to take one more question. This is a question from Mr. Deepak Biswas. This question is to both of you. Self-help group or federation of leprosy affected people is a very good initiative. How this group and federation can be sustainable? This is maybe a bit difficult question for you to answer, but this is very important. So maybe, yeah, Dr. David, you can transfer it. Yeah.
শরীফ সাহেব, আচ্ছা আপনি নিজে উত্তর দিবেন। হ্যাঁ, এইটার হচ্ছে উনি বলছেন যে কিভাবে আমাদের সেলফ হেল্প গ্রুপ তো একটা ভালো উদ্যোগ না, সেলফ হেল্প গ্রুপ আপনারা করছেন, ফেডারেশন ভালো, এগুলো তো ভালো উদ্যোগ, কিন্তু এটা কিভাবে মানে ধরেন ওনারা যদি সাপোর্ট না দেয় তাহলে তো আপনাদেরকে তো চলতে হবে, তাই না? তো ওনার এক প্রশ্ন হচ্ছে যে কিভাবে এটাকে বাঁচিয়ে রাখা যায়। হ্যাঁ, মানে আপনারা তো ওই যে বিভিন্ন ভাবে করছেন না, আপনারা নিজেরা গ্রুপ করেছেন, তারপরে প্রতিদিন মিটিং করেন, তারপর টাকা পয়সা করেন, তো ওই বিষয়গুলো বলতে পারেন যে আমরা তো নিজেরাই সরকারের সাথে যোগাযোগ করছি, তারপরে তো ওই বিষয়টা বলেন কিভাবে ওনাদের সাহায্য ছাড়াই আপনারা এটা মানে চলতে পারে, সম্ভব তো, চলা সম্ভব না? হ্যাঁ, তাহলে কিভাবে আপনি একটু বলেন আপনার ফেডারেশন অন্যান্য ফেডারেশনকে দেখে যে এইটা ছাড়া কিভাবে এটাকে বাঁচিয়ে রাখা যায়। আপনারা তো নিজেরা চেষ্টা করছেন। ওকে,
আমরা নিয়মিত মিটিং করি, কিন্তু মিটিং করাও আমাদের একটু সমস্যা যেটা বলতেছি যে আমরা তাদের সহযোগিতায় যতটুকু আমরা করতে পেরেছি, যদি তারা যদি আমাদের যদি আরো একটু হেল্প করে, আমরা একটু হেল্প করে, তাহলে আমরা একটু ভালো করতে পারবো। আবার একটু আমরা কিন্তু আমাদের একটু আরো একটু দূর আমাদের এগিয়ে যেতে হবে।
হ্যাঁ, কিন্তু ওনাদের সাহায্য ছাড়া, ধরেন ওনারা তো সাহায্য একটা পর্যায় পর্যন্ত দিবে, তাই না? তারপর তো দিবে না, তাহলে কিভাবে আপনারা, তার মানে কি বন্ধ হয়ে যাবে?
না, আমরা মিটিং করব
কিভাবে, তখন কিভাবে চলবে, মানে ওইটা জানতে চান উনি।
আমরা ডিস্ট্রিক্ট ফেডারেশনের সহযোগিতা করব, তারাও আমাদের কাছে হেল্প করবে, আমরা তাদের এইভাবে আমরা চালাতে পারবো।
সরকারের সাথে সরকারের হ্যাঁ বলেন।
সরকার আমাদেরকে কিছু হেল্প করতেছে, সেটাও আমাদের কাজে লাগবে। তাছাড়াও আমরা আরো একটু ভালো করার জন্য আমরা চেষ্টা করবো, বা নিজেদের কিছু পুঁজি আছে এটাও তো আমরা খাটাতে পারি। তার পাশে আমরা যদি আমাদের সাসাকাও থেকে কিছু আমাদের হেল্প পাই, তাহলে আমরা একটু না করলে আমাদের চলতে হবে ওইভাবে। সেটা আমাদের মিটিং, আমাদের নিজেদের দাঁড়াইতে হবে, তাদেরকে বুঝাইতে হবে আমরা এইভাবে থাকা যাবে না, আমাদেরকে উন্নতি করতে গেলে আমাদের নিজেদের উপর দাঁড়াইতে হবে, সঞ্চয় বা আমাদের প্রতিটি কাজ আমাদের ঘটে নিতে হবে, গোছাই নিতে হবে।
Yeah. So what he is saying that of course the support is necessary from a different level, but we are also trying our own, like he's saying that's meeting because they have their own mechanism. So they have the groups regularly, they are meeting and also contacting with the government for this different scheme, and also they have the savings for their group savings. So although they need the support, but they have their own, they want to stand their own feet, but so that they have the regular meeting and savings, and also they wants to work together with the government for this different support. But also they need, he also mentioned, but yes, of course we are trying, but also need support from different source. Yes.
Thank you very much, Mr. Sharif. Yes, yeah, of course, the support from external entity is very important. But as Mr. Sharif said, I think the mindset of the members to be self-reliant is very much key. So I think the member of the Boga Federation has a good mindset. So thank you very much. So now I want to invite Ms. Yuri. Mr. Dori, you can translate the question for her.
Okay. Yuli, pertanyaannya sebenarnya sederhana tapi ini cukup berat ya, karena pertanyaannya itu bagaimana bisa bisa membangun organisasi yang ada ya. Ini sebenarnya yang ditanyakan itu tentang SHG, tapi kalau saya bisa maksudnya ke Permata saja. Bagaimana bisa mendukung Permata cabang itu supaya tetap bisa eksis, Permata cabang itu bisa tetap menjalankan kegiatannya dengan bagus, dan bagaimana mereka artinya secara apa caranya supaya mereka itu bisa melakukan semuanya itu dengan baik seperti itu.
Ya, terima kasih teman-teman di cabang, yaitu kami sebagai di tingkat wilayah memberikan bantuan seperti support atau apa yang mereka butuhkan. Tapi bukan hanya dari segi materi, tapi baik itu dari segi pengetahuan dan lain-lain yang itu bisa kami berikan kepada teman-teman. Selain itu juga teman-teman di lapangan atau di cabang seperti di Goa masih tetap eksis karena walaupun tanpa adanya dukungan mereka masih tetap eksis karena mereka mempunyai komitmen. Selain itu mereka juga istilahnya mempunyai tabungan atau uang kas yang mereka dapat kelola untuk melakukan kegiatan-kegiatan kecil. Seperti setiap bulan mereka memasukkan 3.000 per orang, ataupun misalnya menghadiri suatu kegiatan terus mereka mendapat uang transport, maka mereka wajib memasukkan 5% dari yang mereka dapatkan. Nah, inilah yang dikelola oleh teman-teman di cabang, ya, sehingga pada saat melakukan kunjungan bisa dipakai seperti penggantian transport dan lain-lain, Kak, seperti itu.
Okay. So to develop the branch or the district Permata is they have what is Permata in branch, and they have Permata in province. So from the province just support Permata in branch. So the Permata in branch who have the members in the field can be more stronger. The support is not only the like a fund, but also they give the knowledge also to the officers, to the leader in the Permata branch, and also giving the motivation to the Permata in branch. And they still exist in the district or in the branch because they have a strong motivation. They have a strong commitment to help each other. They also have like a petty cash, the savings from themselves. They have in every month people in the member in Permata branch saving the money is around 3,000 rupiah in every month. And also if they have a like a reimbursement, the transport reimbursement, if when they go to the field, they also give the 5% to the savings. So that's why they have savings. So from this saving also they can go to doing the small activity, still can conduct the small activity, and also like a regular meeting in the branch, they can still conduct it because they have a savings in the Permata branch. So that's why Permata in branch still can exist to help the members in the field. So that's all.
Thank you very much, Ms. Yuri. I think one of the strengths of Permata is the active participation of younger people.
Yes.
We are very much appreciated a number of younger people of the persons affected by Hansen disease participate into this project. So I think that is the strength of Permata South Sulawesi, and other organizations can learn from the Permata. Okay, so thank you very much, everyone. I think time is almost up. We are supposed to finish in 90 minutes, so we are already 10 minutes over. So for the audience, thank you very much for giving us lots of questions. I wanted to introduce many of them here, but because of the time constraint, I have to finish this webinar now. So we will definitely go through each question one by one and respond to you individually. And I also apologize that we are not able to hear the presentation of the friends from Nepal. They are also well prepared, and they conducted very impressive activities. So we try to record their presentations in video and maybe try to share on our website. I also thanks to all the participants, all the speakers and the interpreter from Nepal, no, not Nepal, sorry, Bangladesh and Indonesia. It is a great pleasure to be able to work with you. And even under the new grant scheme, we continue to work. So we are very much looking forward to working with you. And also, under this new scheme, we are going to work with other organizations. So we are very much looking forward to working with all of you. So I just want to make one small announcement before we close this webinar. About the next webinars, we are currently planning to organize sometimes between middle and end of the November. And the next theme will be efforts against leprosy in India amid the coronavirus pandemic. We are planning to invite the representative of organization of the persons experienced by the Hansen disease, the government official, the WHOs, and NGOs. So once the detail is clarified, we'll share the information with you. So again, thank you very much for coming to our first webinar. And I'm looking forward to meeting with all of you at the next webinar. So thank you very much. And have a nice day and have a nice weekend.
Yeah.
So.
Okay, thank you. Thank you.
Bye-bye. Thank you.
Bye.
Okay, thank you. Thank you.